Guys, Ismaila here from Innovarx Global Health. Wanted to take some time out today to talk to you guys about coronavirus. It's all over the news. People are having a lot of questions about it, also known as COVID-19. So coronavirus, what it is, it's a virus that causes a respiratory illness that is going around. Obviously, being that it is a viral infection, very similar to how the flu works, because the flu is also a virus as well too. So we'll take a couple of minutes today. We'll go over the signs and symptoms of the coronavirus, what to look out for, but most importantly, how do we protect ourselves and our loved ones around us. So I'll have Allison talk a little bit about how the virus spreads, and then we'll have Karel speak a little bit about the signs and symptoms of the viral infection.
Thanks. So this new virus is known to spread mainly from person to person, typically between people who are about arm's length or like 6 feet within each other. Usually when the infected person coughs or sneezes, the person within nearby contact can get the disease easily. So you also want to be careful with infected surfaces and objects that have the virus on it. So in public spaces like doorknobs or even just the handle of your car, anything like that, you want to be very careful, and you always want to carry pocket hand sanitizer to just wash your hands normally and regularly, maybe 3, 4, 5 times a day if you can. It's very important. So I'll move it to Karel to talk to you about the symptoms and what you look for.
So according to the United States Center for Disease Control, also known as the CDC, if you're infected with the coronavirus, you're going to experience symptoms in about 48 hours. And some of those symptoms are a cough, a fever, or shortness of breath. So this is a respiratory disease, so you're going to experience symptoms around your chest. And your respiratory tract runs from anywhere along your mouth to your lungs. So what a fever is anything above 37 degrees Celsius. And if you have any of these symptoms, I'm going to pass back to Ismaila. Ismaila is going to tell you about how to take care of yourself and how to prevent getting the coronavirus.
Yeah, so similar to what Karel was mentioning, most of the signs and symptoms are typical to what somebody who has a flu would feel. So the hotness of the body, some chills that could happen. So when we talk about prevention, one of the things that we could do proactively is, one, obviously avoiding people who may be sick, staying away from spaces where there's a lot of contact, because it is a communicable disease, meaning it could be spread by being close to each other. Hand washing is one of the most important things that you could do to protect yourself, but ideally you actually want to avoid using your hands to touch your mouth, your nose. So what I normally recommend is, if you don't have access to hand washing equipment, carrying a hand sanitizer could be the best thing that you could do for you. Now the hand sanitizer has to be at least 60% alcohol. So that's just one of the things where, if you're in public spaces after shaking a lot of hands, always using a little bit of hand sanitizer just to make sure you're disinfecting accordingly. A lot of people have been asking about masks, which sometimes could be very effective, especially if you're in close contact with sick individuals, but it's not the gold standard in prevention when it comes to the virus, especially if you have one mask that you're reusing over and over. Plus the masks do differ in terms of how much protection that they provide for you. So just things to keep in mind. As a company, you could reach out to Innovarx Global Health if you have any additional questions. But definitely share these tips with your friends and families, and listen to your body. If you have symptoms or you have a loved one who's showing those symptoms, seek out and get medical attention, because the worst case scenario with the virus, we could see complications like pneumonia, which sometimes could cause a lot of the fatality that we see. All right, so thank you guys. You guys be safe out there.